I need to talk about Gerald Ellison. I've put this off for, 18 months. My therapist, Margaret, out in Rochester, she says I should record these. Says it's processing. I think she's wrong. I think some things don't process. They just sit there in the back of your clinical brain, and they wait. I was a forensic psychiatrist, 31 years. State facilities, county jails, courtrooms. My job was to sit across from people and determine whether their minds worked well enough to stand trial. Competency evaluations, fitness assessments. I was good at it. I had a system. I trusted the instruments. I trusted the DSM. I trusted my own judgment. I don't trust any of those things anymore. Mohawk Valley Psychiatric Center, upstate New York. If you've never been to a state forensic facility, let me describe Interview Suite C for you. It was a storage room until 2014 when the state consolidated 4 satellite clinics and we needed more evaluation space. Metal desk bolted to the floor. 2 chairs, one padded, one not. Plexiglass divider scratched so cloudy you could barely see through it. One fluorescent tube overhead with a dying ballast that hummed at exactly the frequency that makes your back teeth ache. The room smelled like filing cabinet metal and old paper. It always smelled like that, even after they painted it, like the walls had absorbed 40 years of institutional records and were slowly exhaling them. I'd done hundreds of evaluations in that room. Hundreds. I knew every crack in the ceiling tile. I knew which corner of the desk had a sharp edge that would catch your sleeve if you leaned wrong. I knew the room. I didn't know what was underneath it. October 2016. Court order from Herkimer County. Criminal trespass, 2nd degree. The defendant was Gerald Ellison, age 58. Former civil engineer, 22 years with the State Department of Transportation. No prior criminal history. No psychiatric history. No substance history. The charge was straightforward. He'd been found inside a decommissioned state building at 3 a.m., twice, after being warned. His attorney requested a competency evaluation, which was unusual for a trespass charge, but the judge agreed because Ellison had told the arresting officer something that concerned everyone involved. He said he was looking for a room that he could hear, but couldn't find. I read the intake file the morning of the evaluation. Nothing remarkable. Vital signs normal. Nursing assessment normal. No medications. No allergies. The intake nurse's only notation was, patient cooperative and pleasant. Denies all psychiatric symptoms. Oriented X4. Appears neurologically intact. Standard boilerplate for someone who didn't belong in a psychiatric facility. Ellison was already seated when I entered Suite C. Gray hair, trimmed short. Reading glasses on a lanyard around his neck, hands folded on the desk. He looked like a retired engineer because he was a retired engineer. He looked like someone's quiet, competent grandfather. "Dr. Voss," he said, before I introduced myself. I assumed the transport officer had mentioned my name. I didn't ask. The evaluation proceeded exactly as evaluations are supposed to proceed. I administered the mental status examination. Appearance, appropriate. Behavior, cooperative. Speech, normal rate, normal volume, normal prosody. Mood, fine, thank you. Affect, euthymic, congruent. Thought process, linear, goal-directed. Thought content, no suicidal ideation, no homicidal ideation, no delusions. I wrote no delusions at that point. I'd change that later, or I'd try to. Cognitive battery, trail making A and B, normal. Digit span, forward 7, backward 5. Clock drawing, perfect. He drew the numbers, the hands, the correct time I specified. His clock was better than mine would have been. His GAF score was 85. His competency checklist was flawless. He understood the charges, understood the court process, could name his attorney, could describe the role of the judge and jury. He was, by every measure I had, completely competent. I was ready to write the report. Competent to stand trial. 30 minutes, in and out. Move on to the next file. Then Ellison asked me to stop writing. "Dr. Voss," same calm voice, same appropriate eye contact. "Have you noticed the room?" I asked him to clarify. Below us, approximately 14 feet down, poured concrete, not block, poured. The ventilation connects to the original 1942 HVAC chase. You can hear it if you stop talking for a moment. I stopped talking. The fluorescent tube hummed. My pen was still touching the paper, and underneath the hum of the ballast, underneath the white noise of the building's ventilation system, I heard something I'd never noticed in hundreds of evaluations in that room. A low, steady push of air, not from the ceiling vent, from below, from the floor. I wrote in my notes, "Possible circumscribed delusion. Patient describes concealed room beneath interview suite with architectural specificity. Affect remains flat. No other psychotic features." But I circled the word possible. I circled it twice. I didn't know why. I told myself I was being thorough, clinical thoroughness, due diligence. A competency evaluation requires you to assess the reality basis of a patient's claims. That's textbook. I was not being thorough. I was obsessed. I couldn't stop hearing the HVAC system, not just in Suite C, everywhere. In the hallway, in my car with the windows up and the engine off. That low push of air. Once Ellison pointed it out, it was like he'd tuned my ear to a frequency I couldn't untune. I submitted a records request to the State Office of Mental Health Archives. Architectural plans for Mohawk Valley, original 1942 construction, all renovation documents. The plans arrived the following Monday in a cardboard tube. I opened them on my desk in the admin building, not in Suite C. Something about being in that room while looking at what was underneath it felt wrong. The 1942 blueprints were hand-drawn, beautiful draftsmanship, the kind they don't teach anymore. Building footprint, floor plans, utility routing, structural details. I found Suite C easily enough. It was labeled storage records on the original plans, which matched what I knew about its history. Then I looked at the sub-level. Directly beneath what is now Interview Suite C, the 1942 plans showed a room, 11 feet by 14 feet, poured concrete walls, connected to the original HVAC chase via 6-inch duct. The room was labeled Examination Room B7. Ellison had said approximately 14 feet down. The blueprints showed the floor-to-ceiling of B7 at 13 feet 8 inches. He'd said poured concrete, not block. The blueprints confirmed poured concrete. He'd said the ventilation connected to the 1942 HVAC chase. It did. I pulled the 1973 renovation plans. The entire sublevel had been modified. New utility routing, upgraded electrical, asbestos remediation. Room B7 was gone. Not repurposed. Sealed. The plans showed it filled with concrete block, access corridor removed, the original stairwell covered over and incorporated into a mechanical closet. There was no work order for the ceiling, no facilities management memo, no environmental assessment. Just a pencil notation in the margin of the blueprint, in handwriting I didn't recognize. Per Dr. Ashford, permanent seal. I searched the facility staff records. Every personnel file from 1942 to present. There is no Dr. Ashford in any record associated with Mohawk Valley. I checked the state medical board. No Dr. Ashford licensed in psychiatry in New York during that period. The person who ordered that room sealed does not exist. I went back to see Ellison. Same chair, same folded hands, same reading glasses on the lanyard. He hadn't been told about the blueprints. I'd told no one about the blueprints. "You found it," he said when I sat down. Not a question. I asked him how he knew. "You're sitting differently. Your weight is forward. You didn't open your file before speaking. You came here to ask me a question, not to evaluate me. That's a different posture." He was right, about all of it. I asked him what was in the room. A wooden desk, government issue, probably 1950s. A metal folding chair, a tape recorder, a Wallensack T1500, the model the state purchased in bulk in the 1960s, and one cassette tape in a plastic case sitting on the desk. I asked how he could possibly know that. "I told you, I can hear it." He adjusted his glasses on the lanyard. "The tape recorder isn't running, but the tape is waiting. I think it's been waiting for a long time. I think it's for you, Dr. Voss." I documented the interview. I wrote, "Patient maintains fixed belief regarding concealed room with remarkable specificity. No other psychotic features. Diagnostic impression remains unclear." I didn't write what I was actually thinking. This man is not delusional. I've sat across from delusions for 31 years. Delusions shift, they contradict, they defend themselves when challenged. Ellison's claim had none of those features. It sat there like a load calculation, like a fact. That afternoon, I told the maintenance foreman I needed access to the sub-level space beneath Suite C. Possible asbestos concern. He looked at me for a long time. Then he said, "B7? I asked how he knew the designation. "I don't know." He rubbed the back of his neck. It's one of those things. Everybody down here knows about B7. Nobody can tell you who told them." His crew cut through the concrete block the next morning. 40 minutes. When the last block came out, the air from the opening was cold and smelled like damp concrete and something electrical, like a machine left on. The room was exactly as Ellison described. The desk, the chair, the Wallensack T1500 power cord coiled neatly beside it, and on the desk, in a clear plastic case, a single cassette tape. I stood in the doorway and listened to the silence of a room that had been sealed for 43 years and still smelled like someone had been there yesterday. I took the cassette tape to my office, didn't sign it out, didn't log it, put it in my coat pocket and walked through 3 locked doors and 2 security checkpoints. No one asked what I was carrying. The records room had a cassette player, an old Panasonic from before everything went digital. I pressed play. Static. Then a click. Then a voice. The voice was conducting a psychiatric evaluation. Standard structured clinical interview. State protocol format. The questions came in the exact sequence I use, not the textbook sequence. My sequence. I reorder sections 3 and 4 because patients respond better when you ask about sleep before mood. It's a habit I've had for 20 years. No one taught me that. The voice on the tape used my sequence. The evaluator spoke calmly, professionally, slightly flat, the way you sound after too many evaluations in a row. I recognized that tone from my own dictations. The patient's voice was different, hesitant, guarded. The evaluator asked about sleep. The patient hadn't been sleeping. Asked about intrusive thoughts. Long pause. He said he couldn't stop thinking about a room, a sealed room. He said he could hear the ventilation system everywhere he went. He said he wasn't sure the sound was real. The evaluator asked about reality testing. The patient said he checks the date on his phone 20 times a day. Not because he forgets, because he's afraid the day he's living isn't the day the calendar says it is. I check the date on my phone. I've been doing it since the Ellison evaluation. 20 times a day, sometimes more. The evaluator's voice continued. Mental status findings. Appearance appropriate, cooperative but guarded. Speech with increased latency. Mood described as not right. Affect constricted with anxious undertone. Thought content significant for preoccupation with sealed architectural spaces. Possible delusional framework versus overvalued ideation. Cognitive function grossly intact. Insight impaired. Patient believes experiences are real. Then the diagnostic impression. Adjustment disorder with mixed anxiety and depressive features. Rule out delusional disorder, unspecified. Margaret, my therapist, gave me that exact diagnosis 3 weeks before I found the tape. Same words, not similar, the same. She wrote it in my file. I asked to see the note. The evaluator stated the date. I stopped the tape, rewound, played it again. The date was 8 months from now, June 2017. The facility, Mohawk Valley. The interview location, Suite C. I sat for a long time. The tape kept playing. Post-session notes, the evaluator dictating alone. The voice said, patient presents with fixed belief regarding a room beneath the facility. Circumscribed delusion possible. Recommend continued observation. I pulled out my clinical notes from the first Ellison evaluation. Before the blueprints, before any of this. Possible circumscribed delusion. Patient describes concealed room beneath interview suite with architectural specificity. The tape's words and my words were not similar. They were identical, the same clinical language, the same hedging, the same sentence structure, as if the person on the tape had read my notes, or as if I had been writing from a script I didn't know existed. The tape was still running. I realized there was more. The evaluator, my voice, or a voice exactly like mine, said one final thing, a recommendation. I heard it clearly through the small speaker of that old Panasonic. Recommend patient be evaluated in 8 months. Interview Suite C, per Dr. Ashford. Per Dr. Ashford, the name from the 1973 blueprint. The person who ordered B7 sealed. The person who doesn't exist in any record. I reached for the stop button on the tape player. Before my finger touched it, the tape clicked off by itself. The reel stopped. The room was silent except for the HVAC, that low push of air from below, which I will hear for the rest of my life. I looked at my own notes one more time. The last line of my Ellison evaluation, the recommendation. I'd written it in my own handwriting, and I do not remember writing it. It said, recommend patient be evaluated in 8 months. Interview Suite C, per Dr. Ashford. That was 18 months ago. I retired 11 days later. Margaret says I'm making progress. I checked the date on my phone. It says what it's supposed to say. For now, Ellison was released, charges dropped. The court found him competent. Of course they did. He was the most competent person in that building. I never went back to Suite C. I never went back to B7. But sometimes late at night, in this farmhouse outside Utica, I hear the ventilation. There is no ventilation system in this house. There is nothing below me but a dirt crawl space and old fields.